So, what's radiotherapy? So we're going to start by talking about radiotherapy from the radio side, the technical side, the scary side, the funny-looking side. And these slides really kind of encapsulate that and show you the technical side of what we do in radiotherapy. So radiotherapy is using high-energy X-rays to target the cells or the cancers that we're treating. And these two images kind of show the journey that radiotherapy has been on. Radiotherapy is a fast-moving profession. Things are always changing, always developing. What you can see on the right-hand side is kind of what radiotherapy was like perhaps when I had my treatment done. So you can see that on the right-hand side, we've got 4 beams of radiation coming in. They're just making a big block around what we're trying to treat. And so we're giving radiation to what we're trying to treat, but we're also delivering some radiation to the surrounding organs as well. So for patients that were having treatment at that time, they would have experienced more side effects than the treatment that we were delivering. What you can see here on the left, down at the bottom, is more like what we can do now. So hopefully you can see on there, you've got somebody's head, you can see their eyes looking upwards. And we're treating around this person's eye and around this person's optic nerve there to make sure that we can preserve their sight, make sure that we can look after them the best that we can. So it really just helps to highlight the difference in kind of how we can go about doing this treatment and delivering this treatment for the people that we now serve. Radiotherapy, as I said, it is a very versatile form of treatment. About half of all cancer patients will have radiotherapy in some form during the course of their treatment, so we can use it for curative purposes. We can use it in some cases to prevent cancer from happening. We can also help with symptom management and just helping people have a better kind of quality of life. Away from the, I guess, the technical side of things, this gives you a bit of a view into the other side and the human side of radiotherapy. So you've got someone there that is lying next to a radiotherapy machine, and that looks quite similar to the ones that we use in radiotherapy. And you get a bit of a feel for what it can be like being in that room, being by yourself, being surrounded by all this scary stuff, having these lasers and lights all pointing at you. And typically, if you're having treatment for breast cancer, you would also be bare-chested when you're having this treatment, so you can be feeling really vulnerable while you're having this. So what I'd like to do is just quickly talk you through kind of the pathway that people would come through when they come to a radiotherapy department. And we do have over 100 people that are working within the radiotherapy department, so you'll find out that being a radiographer doesn't even mean one thing. It can mean 100 different things to different people. So that's a picture of the treatment machine and what the treatment machine looks like. Your first encounter in radiotherapy is going to be having a CT planning scan. So some of you will be familiar with what a CT scan looks like. Kind of looks like a polo mint or a big donut. And you go into the rooms, and then you kind of have to get yourself onto the bed. We'll have some scary-looking equipment on there, similar to what you can see, which all looks a bit unfamiliar. And that's really where the work, for me, starts. What I really want to get across is that the treatment is not the same for everybody. It's not a one-size-fits-all. And what we do in radiotherapy is highly personalized, and we treat everybody as an individual, as we should. And this is really where that process starts. So getting you into that room, making you feel as comfortable as you can be, and it's never going to be the most comfortable thing. Those rooms can be dark, they can be daunting, they can be definitely be cold. I can tell you from being in there for like 10, 12 hours a day, it's a cold room to be in as well. But this is the process where we start actually figuring out who you are and what we can do to make this treatment kind of work the best for you. So all these little bits of equipment that we have on the bed, we can customize them, we can move them, we can change them, we can even make pieces of equipment to make sure that you're as comfortable as you can be for the treatment. So the most important thing for radiotherapy is that our patients are able to be still for the treatment, to make that treatment safe, to make that treatment effective. You've seen on the last slide how small the areas can be that we're treating. So we need to make sure that you're as still as you can be when you're having the treatment done. And a big part of that is making sure that you're as comfortable as you can be. And that really starts by having that conversation, developing that relationship, and putting plans in place for you. And this is really and the CT part that's really where we start. So once we've gone through that process, we made all the little adjustments that we need to try and make sure that you're as comfortable as we can. We've learned kind of what's going to work for you and what's not going to work for you. We can then take that scan, we can record down all of that information, so then we can get the treatment started on the best footing, and making sure that you're going to be having the best treatment on the first day that you attend, all right the way through to the last day that you finish. So once you come in and you've had that scan done, we then have to go back and plan your scan. If you go back to the last slide, I can just show you. So once we've done the scan, then we'll have an image like this that we can start working on actually putting a treatment plan for you together. So we already have some information about who you are as a person. Obviously, we've got the story and we have the diagnosis, but we've met the person now as well. We've given you an idea of kind of what radiotherapy looks like and what it's going to feel like to some extent. You know the equipment that you're going to be on, and we've been able to figure out kind of what's going to work for you and what's not going to. So we can start taking that information and looking at these scans. So you have radiographers that will be helping in this process and planning the treatment. Also have physicists involved and also have doctors involved to make sure that we're delivering the best aims that we can for you with the treatment that you're having. So once we've gone through that process, you see that we've already met you twice. You already met you a couple of times, and we've already kind of gone through this process of getting to know you, really understanding kind of what we're trying to achieve with the treatment. You'll come through to the radiotherapy itself. And as you can imagine, the first day of radiotherapy, again, it can be a very daunting process, a very daunting procedure. But that, for me, is really what makes radiotherapy so special. It's seeing your patients every day as they have their treatment. So with radiotherapy, you can have anything from just one treatment all the way right through to 37 treatments, having them once a day, usually Monday to Friday, with a couple of days off in between, just to give your healthy cells a bit of a chance to recover from the treatment as well. So one of the main benefits of radiotherapy is that we're able to give treatment to the area that we're trying to treat and keep the side effects kind of localized to that area. And we have a huge team of people around you that are there with you every step of the way to try and help with those side effects when they come up. Definitely during COVID and even now, when you come in for your radiotherapy treatment, we're typically seeing our patients definitely more than they see their doctors. And then especially during COVID, like I said, we were seeing people more often than they were seeing perhaps their family members as well. So as a radiotherapist, you're really there to be that first port of call and to really help with the human side of delivering the treatment. So we'll be in the room with you, making sure that everything is still working as it should do, everything still fits for you, everything still is working for you, and things do change as you go through with the treatment. And we have to be able to kind of adjust to that, and we're there to really kind of advocate on your behalf and to make sure that we're delivering the best treatment that we can on a day-to-day basis. So we're really there to bring the whole together and bring everything into, bring the whole together and make sure we're delivering safe and accurate treatment. So you have to kind of use those two dual roles. So I have to be with you there as the person, but then also have to be able to go back and have a look at those images, interpret those images, and make sure that what we're doing is safe, accurate, and it's going to be the best thing for you on the day. So that's on the main kind of treatment side of things. As well as having the treatment radiographers, we do also have a specialist review team, so I want to mention them too. So the specialist review team, they are radiographers that have been through the process, delivered the treatment, understand what that journey is like, and then are there as an additional resource. So as well as coming in and seeing one of us every day to put things in place for you, also have a dedicated member of staff, or you have a dedicated review team, just to give you a separate space where you can sit and you can talk. Sometimes it's not always easy to do that when you come in for your treatment. And then, we can go on to the next one. And, I am also going to talk to you today about why you should always listen to your mum. That is a picture of my mum wringing my neck, and actually quite enjoying it as well, I want to point out. So the reason why I bring this up is when I finished my treatment, one of the memories for me, I'm now 20 years on from my treatment. This year is my 20th year. Actually, this month is this is the month, right? 20 years this month since I had my treatment. Even at the age of 13, one of the most vivid memories that I have of the treatment was going in on my last day with my little card and my box of chocolates for the radiographers, and just feeling that it just wasn't enough. That real feeling of it just wasn't enough to really convey the depth of gratitude that I felt towards those people. Because for me, I looked at them and they had no idea what a difference they had made to my life. And I had 6 weeks of radiotherapy. And I really wish that more radiographers knew how much of a difference those 10 minutes or 15 minutes can have on someone's journey when you're going through. So I went in with my little box of chocolates and thinking that's never going to be enough. But thankfully now, as a radiographer, I can 100% tell you a box of chocolates is the way to make a radiographer's day, 100%. So I've been able to heal that scar as well. So yeah, that is me talking about radiotherapy. Thank you. Thank you.
My name's Ali Bell, and I was diagnosed with breast cancer in 2019. My treatment was at Colchester General Hospital, although subsequently I've moved to Norfolk, so my follow-up monitoring is under the care of the Norfolk and Norwich Hospital. Pre-treatment. It all happened very quickly, started with a routine mammogram. I was recalled for further imaging, which involved an ultrasound scan, biopsies, and then waited a week for the results. 1 week from my diagnosis of breast cancer, I was having surgery to remove a breast lump, followed by 6 weeks later with the removal of my lymph nodes. At this surgery, I had blue dye injected, which gives my skin a blue appearance. Because of this, one of my colleagues dressed me up as a Smurf to go to theatre. After my surgeries, I met with the oncology team who informed me I had to receive a 6-week course of radiotherapy. Prior to this, I would undergo mapping and tattooing. Mapping, or simulation, is a preparation session which plans your radiation treatments to ensure the right dose is given to the correct site with minimal damage to the nearby tissues. Tattooing. I imagined big black dots that would be visible forever to everyone. In reality, they're so small they're hardly visible and look like a very small freckle, which is permanent. Having never had a tattoo, I wasn't quite sure what to expect, but it's only a small injection just under the skin that stings a bit. I had a 6-week course which involved attending the radiotherapy unit 5 days a week. The team were able to arrange times that suited me. Another of my colleagues jokingly suggested that I might gain superpowers like Superman, so hence a photo of me with the ladybird increasing in size as my treatment continued. Like any medication, radiotherapy has side effects, and the most common being tiredness. It's like flying around the world every day for 6 weeks with increasing jet lag. During my radiotherapy, I was very fortunate to have family and friends to support me. They took it in turns to drive me to my daily sessions, which helped me cope with the tiredness and gave me an enormous sense of being loved and supported. On return home, I was often provided with a meal for the evening. It took some of the pressure off my husband, and I will remain forever grateful to them. Some patients want to know every detail of their treatment, while others just want the very basic information. I want to say that there is no right or wrong way. We are all individuals. I was asked by a colleague shortly after my diagnosis, "What's your prognosis?" This wasn't even a question I'd thought to ask the consultant. However, when I spoke to my named nurse, she was on hand to reassure me and support me. The nurses are always there to answer questions and usually returned my call the same day. They're an extremely valuable resource and certainly put my mind at rest on more than one occasion. My work was also very supportive during my treatments. I was able to come to work if I felt able and only work the hours I could manage. Having a helpful, sympathetic manager ensured I could maintain some normality to my life during this very difficult period. As treatment progressed, tiredness increased. Try to get plenty of rest and be prepared to say no to visitors if you just need to sleep. You can always use the time to watch all those movies you never had time to view. The main other aspects of side effects for me was burnt skin. There are several things that can be done to relieve side effects, and the earlier you report the symptoms, the sooner treatment can begin. At completion of treatment, I got to ring the bell where it says, "Ring this bell 3 times. It's told to clearly say, my treatment's done, this course is run, and I am on my way." Post-treatment, this is a period when the diagnosis really hit me. Up until then, it had all been about scans, blood tests, surgeries, treatments. When it's all over, you have time to reflect, and this can be quite emotional. The Big C Centre is a great place to visit where you can meet up with professionals as well as patient support groups. I did attend a Look Good, Feel Better session, which was run by local professional makeup artists who give their time and talents for free. I personally found sharing my experiences, good and bad, to help to continue to improve care and communication for all future patients by giving the healthcare professionals the understanding from a patient's perspective. Thank you for listening to my story.
I started working back at the hospital back in 2018, first as a healthcare assistant on the bank, before securing a permanent contract up in Hethel Ward, which, as some of you know, is a respiratory ward. I then worked clinically through the pandemic and had the privilege of working alongside some of our lung cancer patients. It was this experience and the awareness that the support provided to those patients that led me to apply for this job as a cancer care navigator. So my role predominantly as a cancer care navigator, or as a CCN, as sometimes we're known as, No acronyms. All right, cancer care navigator, sorry, is to complement our clinical nurse specialist colleagues with the holistic support they provide to our lovely patients. So since our service launched back in August of 2022, we have made and received over 3,000 phone calls from both patients and relatives. We have provided cover for the amazing Macmillan pod here at the hospital, and also the North Norfolk Macmillan Information Centre, which is situated in Cromer. We have participated in some outreach sessions to raise awareness for cancer symptoms and the support that is available. We have done this in places such as Castle Quarter, also known as Castle Mall to most of us, local garden centres, community centres, and last year with some of our members of the cancer service team, we also ran 4 Time for You sessions at Norwich City Football Club, which were educational and support sessions for our patients and relatives. As a CCN, we aim to contact patients approximately 21 days after diagnosis to introduce our service and to complete what we call holistic needs assessment. I won't say the acronym for that. But as a patient or relative, you need to know that you don't have to wait for this phone call. We're available at any time should you have any queries or concerns. So holistic needs assessment is a checklist developed by Macmillan which details concerns a patient may have, which you can see on screen here. These are listed under specific headings such as physical, practical, family or relationship concerns, informational support, and emotional concerns. The H&A helps us to focus the conversation on what is important to our patient at that specific time, what it is they are worried about, or any questions that they may have. We then are able to provide information, support, and signposting to empower the patient to overcome these concerns and worries. This may include referrals for financial assistance, wellbeing support, additional aids for the home, help with washing and or dressing, transport, or simply someone to speak to about how they are feeling without any pressure or prejudice. As a team, we are available at all stages of the pathway, from initial diagnosis through treatment and also beyond. We want our patients to know that our support doesn't stop once their treatment has finished. If anything, concerns and worries can become heightened once treatment has reached that end point in the pathway, as you've heard from our lovely representatives today. Our telephone calls are completely varied, ranging for those who just want to chat for 5 minutes to those who have lots of concerns and issues and require additional support in calls that can last up to an hour. Neither is right or wrong, and it is what is best for our patient at that time. Although cancer is a very scary and worrying time, we find a lot of our patients, thankfully, already have a good support network around them. So when we call at their early stage, their focus is on their initial treatment, and they simply appreciate someone independent asking, "How are you?" Some of our calls have taken us by surprise, so I thought I'd share some examples. We've had more than one patient answer the phone with, "Make me a winner." They were understandably slightly disappointed we were calling and not Heart FM offering them a chance to win £30,000. Thankfully, it was a really good icebreaker, and our patients, hopefully, soon forgave us for possibly ruining their chance to win big. Our lovely prostate patients tend to be in the garden or in the garage and usually pass the telephone to their wife or partner and promptly put the phone on loudspeaker for their wife or partner to participate. Some patients have no concerns but are keen to share useful resources for us and our other patients, which we always love to hear about. It never fails to amaze us that whilst they are going through treatment, they're still thinking of others. We receive lots of feedback on our service and that of our CNSs. Our patients like to know that there is additional support if and when they need it, and this just makes my job so much more enjoyable. My motivation comes from the reward and satisfaction in supporting patients through what can be the most difficult time in their lives. Speaking with patients and providing a listening ear is sometimes all they need to get them to their next appointment or through to their next treatment. The resilience of our patients drives me to always do my best and know that my phone call and support can make a difference. Thank you.
Most probably, the reason I'm standing here today is because of the loss of our daughter, Jennifer, at the age of 22 as a result of an undiagnosed brain tumour. This is Jennifer. Our family's health-related story began on the 1st of October 2005 when my husband, Colin, suffered a major stroke. This resulted in physical disability and communication difficulties which are ongoing. There was a lengthy period in hospital and rehabilitation. Prior to this, Jennifer had been suffering from debilitating headaches and various other symptoms. We found it difficult to be taken seriously about Jennifer's symptoms as these were put down to life stressors, and sadly, Jennifer passed away on the 3rd of July 2006, without us knowing what was wrong. Only after post-mortem was it confirmed that a brain tumour had been the cause of all of Jennifer's symptoms and untimely death. This had a devastating and lasting effect on our family. No diagnosis meant no opportunity for treatment or appropriate care or support. Fast forward to 2009, when I first consulted my GP with bowel-related symptoms. I was eventually diagnosed with bowel cancer. A date for surgery, a hemicolectomy, was made 6 weeks later. Following surgery and after trouble with an infected wound, I had 6 months of oral chemotherapy. Coming up for 14 years later, I'm still here to tell the tale. In some ways, it is only now that I can reflect on my cancer experience. I was aware of bowel cancer, but didn't expect to be diagnosed with it. It's good to see that screening for bowel cancer is now in the process of being made available from age 50 to 74. Recently, I've been impressed with referrals that my husband and I have had from our GP to the dermatology department in relation to skin lesions. We have appointments in timely manner and were provided with relevant information for Colin. In my case, I've had topical treatment and have been reassured the lesions are not cancerous. In 2018, I wanted to find out more about brain tumours and went along to a meeting for the Brain Tumour Support Group, which was held at the Big C Centre here at the hospital. I've been involved with the group since that time and have facilitated it for a good number of years now. Also, following my surgery in 2010, I attended the meeting of the NNUH Bowel Cancer Support Group. There, I met with the then chairman of Together Against Cancer in Norfolk and was invited to join the group, which I did. This enabled me to raise awareness of the lack of clinical nurse specialists for the brain tumour patients at NNUH. Between the efforts of the support group and Together Against Cancer, I think that this did speed up the process of the first clinical nurse specialist for brain tumour patients here at the hospital being appointed. The photograph in the background is of our newly relaunched Brain Tumour Support Group, Norfolk and Waveney, which took place in November 2023, having been suspended for COVID. Through TAC, I also participated in the Be Clear on Cancer campaign with respect to bowel cancer. I was also delighted to be given the opportunity to participate in early research project BRACED, the Brain Tumour Early Detection Study at the University of Cambridge. This has given me fascinating insight into the complexity of diagnosing brain tumours in a timely manner. The research contributed to the brain tumour charity's Better Safe Than Tumour campaign. At present, I am also a member of the Service User Advisory Board at the Big C and attend meetings of the Carers Forum at the NNUH. I also take interest in our GP services as a member of their patient participation group. To sum up, having been a member of the Together Against Cancer group since 2010 and involved with the Norfolk Brain Tumour Support Group since 2008, I have always endeavoured to promote the importance of symptom awareness, as this might have prevented my daughter's untimely passing. Effective communication and concise terminology are crucial to achieving an early diagnosis. In addition, I recognise the important role played by those who care for and support patients on their cancer journey, as well as other health conditions. Those who care need to be looked after too. I'm afraid I feel compelled to give Norwich City Football Club a mention in all of this. For the first time in my life, I went along to a football match in July 2006 with Colin and our son Ewan. Supporting the team has since become part of my life, and the club has given us several opportunities to promote awareness of both brain tumour and stroke. Jennifer was an ardent supporter of the Canaries, and this is part of her legacy to me. Ill health and disability have most definitely changed our lives. To conclude, it has been interesting and informative to listen to the role that the health professionals and administrative staff play in the patient's cancer journey. Likewise, as members of the Together Against Cancer group, we have welcomed the opportunity to recount the experiences of our cancer journeys from diagnosis to treatment and beyond. Also, the impact that cancer diagnosis has had on our lives. Thank you for providing the opportunity to speak at this World Cancer Day event at the NNUH. Finally, thank must go to Joe, Rachel, Bethan and Becky for all their hard work in organising the event. Also the support they have given us as members of TAC in preparing our presentations for today. Thank you.
The reason I get out of bed every day and have done my entire career is because of everybody that has spoken today, for their passion, their drive, their energy and their commitment. And today it's about patients with cancer. And that's what we've heard all day today. It's about prioritising our patients. And every speaker has demonstrated their integral contribution to the care and treatment of thousands of patients before, now and in the future. And every colleague from Norfolk and Norwich, I think, has really demonstrated their personal reflections, their personal contribution, the rationale, the reason, their drive for doing the things that they do, the job that they do. And without hearing the patient stories, because the patient stories that we've heard today provide such a valuable contribution to us at the Norfolk and Norwich and other cancer centres, because without hearing back from the patients at every part of the journey, we can't make the improvements. And what you've heard from the patients today is that actually kindness is the currency that they need from everybody, every phone call, every letter, every diagnostic. That they want clarity of communication, clear, very clear, and also easy to understand, but also that they can come back and ask questions. And what that amounts to is time. Give us time. Time to ask those questions. Time for our partner to ask questions and our families. Give us time. Give that time when you listen, that you do not speak. It's really hard for us as clinicians and non-clinicians to do that. But that time that we heard right from the beginning, when Nick spoke about his wife's reflections, or his reflections on that. Because what we know is from the patient stories is it's not fast enough. That weekend we heard, when I don't hear anything, I've got to go home, I've got to be a mum, I've got to be a partner, that's a long weekend. Those 28 days are a long 28 days. So the imperative and integral contribution that our patients make are that you tell us what we still need to do better, we need to do faster, and we need to do together. And there is still so much. Having spent a lot of time over recent months with all of our tumour site breast cancer nurse specialists, they've all got really innovative ideas about shortening that time. And that has come from patients. So without days like today, we cannot get a better, more innovative service. And so that is why this is an alliance, and that's why days like today, like the World Cancer Day, are so special, because it gives us the motivation and the energy to carry on and make sure that we speed up that time. We will give that time back to patients and families. And so those beach days will become more beach days and more farm days. That's why we come to work. That's why all of the cancer specialists, and that's why every member of every pathway that you've heard today loves their job so much. So thank you to all of you for being part of the cancer pathway at the Norfolk and Norwich, because it's actually like a family. So sharing today, I hope that you have really enjoyed it, but also that you now feel you can come forward with ideas, because we've never, ever got time to not listen to you, and we want to keep learning. The days like today wouldn't be possible without IT experts. Always the forgotten person behind the screen. And I just want to say Rachel's hiding, but actually it's really important to keep everybody to time. But it really does make a difference that you've come, and I just wanted to say thank you to all of you for sharing the World Cancer Day with us. I want to say thank you for Together Against Cancer. Without the patients and the support, these days are not possible. I have to say thank you also to the Norfolk and Norwich charity and Sponge for the beautiful refreshments. And just remember, we need to keep working together. We need to keep hearing from you. And if you would like to be part of next year's World Cancer Day, speak to Jo, because she's starting planning tomorrow. Thank you very much.